Welcome to Cardiology Day on 10 Daily Medical Questions. Today we are starting a new series on heart failure, which we will explore over the next 5 Thursdays. In these videos, we will dive into key aspects like pathophysiology, clinical presentation, diagnosis, treatment, complications, and advanced therapies. By the end of the series, you will have a solid understanding of heart failure and its management. Let's get started. Question 1. What is heart failure? Answer. Heart failure is a clinical syndrome characterized by the inability of the heart to pump blood effectively to meet the body's demands, or to do so only at the cost of increased filling pressures. Interesting fact, despite its name, heart failure doesn't mean the heart has stopped working. It means it is functioning less efficiently. Question 2. What is the major type of heart failure based on ejection fraction? Answer. Heart failure with reduced ejection fraction, EF less than 40%, heart failure with mildly reduced ejection fraction, EF between 41 to 49%, heart failure with preserved ejection fraction greater than or equal to 50%. Interesting fact, heart failure with reduced ejection fraction is also known as systolic heart failure, while heart failure with preserved ejection fraction is termed diastolic heart failure. Question 3. What is the primary pathophysiology behind heart failure with reduced ejection fraction? Answer. Heart failure with reduced ejection fraction is caused by systolic dysfunction, where the heart's ability to contract is impaired, leading to a reduced stroke volume and cardiac output. Interesting fact, the Frank-Starling mechanism partially compensates for heart failure with reduced ejection fraction by increasing preload to maintain cardiac output. Question 4. What is the primary pathophysiology behind heart failure with preserved ejection fraction? Answer. Heart failure with preserved ejection fraction results from diastolic dysfunction, where the left ventricle has impaired relaxation and increased stiffness, leading to increased filling pressures. Interesting fact, unlike heart failure with reduced ejection fraction, most patients with heart failure with preserved ejection fraction have normal left ventricular systolic function, making diagnosis challenging. Question 5. What are the most common causes of heart failure with reduced ejection fraction? Answer. Coronary artery disease or myocardial infarction are the most common causes, and the other causes are hypertension, dilated cardiomyopathy, valvular heart disease, and myocarditis. Interesting fact, alcoholic cardiomyopathy is a most reversible cause of heart failure with reversed ejection fraction if alcohol is discontinued early. Question 6. What are the major causes of heart failure with preserved ejection fraction? Answer. Hypertension, that's the most common cause. The other causes are obesity, diabetes mellitus, atrial fibrillation, aging-related myocardial stiffening. Interesting fact, women are more likely to develop heart failure with preserved ejection fraction, while men are more prone to heart failure with reduced ejection fraction. Question 7. What is the role of the renin-angiotensin-aldosterone system in heart failure? Answer: RAS activation increases angiotensin II and aldosterone, leading to vasoconstriction, sodium retention, and fluid overload, which worsens heart failure. Interesting fact: ACE inhibitors like enalapril blocks RAS activation and are a cornerstone of heart failure with reduced ejection fraction treatment. Question 8. What are the cardinal symptoms of heart failure? Answer: dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea, fatigue, peripheral edema. Interesting fact: weight gain before edema appears can be an early sign of fluid retention in heart failure. Question 9. What are the main physical exam findings in heart failure? Answer: jugulovenous distension, pulmonary crackle, S3 gallop by heart failure with reduced ejection fraction, S4 gallop by heart failure with preserved ejection fraction, and pitting edema. Interesting fact: an S3 gallop, ventricular gallop, is highly specific for heart failure with reduced ejection fraction. Question 10. What biomarkers are used to diagnose heart failure? Answer: brain natriuretic peptide BNP, N-terminal proBNP, NT-proBNP. Interesting fact: BNP is released from ventricular myocardium in response to increased valve stress. That's it for today's session on heart failure. Stay tuned for next Thursday as we continue this deep dive into its different aspects. If you found this helpful, don't forget to like, subscribe, and share your thoughts in the comments. See you in the next video.